Hi, my name is Patrick Laquette, and I'm your nursing school tutor for today. All right, so today's segment, we're going to be talking about a part of the endocrine system, and that's specifically your thyroid. So today's lecture topic is going to focus on this little area right here. So this is going to be your thyroid gland, right? So your thyroid gland, I always emphasize knowing the anatomy and physiology of things. That way, that when there's a dysfunction in a certain area, you already know that that functionality is what's affected. So today we're going to be talking about the thyroid gland. Now this is the area in front of your trachea, which is your neck right here, and it's going to be in the little shape of a butterfly, right? So you can actually tend to feel that, and the way you feel it is if you palpate that front of your neck and you swallow, you're going to feel little grooves and ridges in what can be described as a butterfly shape. That's going to be your thyroid. So when we talk about your thyroid, it has one big functionality and multiple functionalities, but I want you to think metabolism. Okay, I want you to think metabolism. Now, when we look at the general public, social media, what we hear metabolism from is basically someone with high metabolism digests things faster, someone with low metabolism digests things lower. Now, it goes a little bit deeper than that. So let's talk about your thyroid, which all in all functions as the regulator for your metabolism, energy, and growth. When we talk about your thyroid, we need to know three things that it produces, three hormones to be specific. And that is going to be your thyroxine right here. That's T4, okay? That's triiodothyronin, which is your T3, and your calcitonin. So just remember T3, T4, calcitonin. The easy way for you to remember that is T for thyroid, all right? T for thyroid. Now, we can't talk about the thyroid without talking about your little organ up here, which is your hypothalamus and your pituitary gland. So that secretes TSH, which is called a thyroid stimulating hormone. So how it goes is TSH is produced up here. It sends it down to the thyroid, right? And your thyroid then produces your T3, T4, and calcitonin, okay? Off with your hyperthyroidism. All right. So hyperthyroidism, we know your thyroid produces things that make you increase energy, increase metabolism, increase growth. So with that being said, increase in all of these, right? Increase in your metabolism, increase in energy. Think everything up. Everything's going up, up, up. So what does that mean? So let's take a look at a little bit about some lab values you're going to be taking a look at. So increase in T3, T4. That's already what we talked about. That's what your thyroid produces. Now, from your pituitary gland, because it's not producing enough TSH. So from your pituitary gland, it's not producing enough of that thyroid stimulating hormone. What does your thyroid do? It tends to produce more T3, T4. It's overproducing. So what happens with that? Think about someone with ADHD, anxiety, right? You're on the go, on the move, high energy. So that's what's going on there. You're super excited, hyper excitability. You're shaking, nervous, tremor, right? Think of your vital signs. If you're up, everything's up as well. So heart rate up, blood pressure up, right? Metabolism's too high. So what happens to people with high metabolism? They lose weight faster. They're sweating a lot, right? You're losing hair because it's just going so fast. So I want you to kind of think of that person as skinny, right? Skinny, sweaty, oily, all right? The three S's, skinny, sweaty, and oily, because you're just on the go. You're always hungry, all right? You're always hungry and you're losing weight fast because you're just using up too much of your metabolism. Now, if we take it a next level, there is a specific disease that stems from hyperthyroidism, and that's this, Graves' disease, okay? Graves' disease. With Graves' disease, you're still going to be, your main concern is your blood pressure is up and your pulse is high. Your heart rate's up, blood pressure up. But one classic symptom, and I always emphasize remembering your classic symptom, is going to be exophthalmos. Exophthalmos means bulging eyes. If you see this picture on the bottom right here, that is what we mean by exophthalmos. That is your bulging eyes. Because think about a hyper excitable person and you're just bulging right there. All right. Now, we can't talk about your hyperthyroidism without talking about the extreme form of this, and that is what we call a thyroid storm. That is an emergency. So what do we mean by a thyroid storm? So when you're producing those T3, T4s, you can produce it in high levels. Now, what can do this? For example, you are hypothyroid, which means your thyroid is low. You can be receiving medications and you can be overdosing on these medications. Or something goes wrong with your thyroid, right? It's just overproducing. So that's what we call a thyroid storm. Now, what do we want to be concerned about with your thyroid storm? Your thyroid storm, right? You're gonna have the same symptoms, same symptoms, but now take it to the extreme level. Now multiply that by 20, right? You went from 0 to 100 real quick, right? You're just overly excited. But if we think about your ABCs, your main concern is going to be A, B, C, your circulation, right? Your blood pressure is way too high. Your pulse is way too high. Now, when your pulse is way too high, your heart's beating fast, like really fast. Now, think about you as a person, and I give you a 10-pound dumbbell, and I ask you to curl that real slow, right? Real slow. You could probably do it, a little more than most. But if I tell you to curl it really fast, and I tell you to do it 50 times over, you're going to get sore, and eventually your muscle is going to cave in, right? You're going to give out, right? And you can't do it anymore. That's the same thing that's going to happen to your heart. It's just going to give out. Your blood pressure is too high, and what are we concerned about with a blood vessel that has a high amount of pressure? It's going to burst, right? It's going to burst. And that's what we call an aneurysm. And this person can have a stroke. Right, so we're going to be talking about the treatments, right? We're going to be talking about the treatments. In the case of a thyroid storm, which is your emergency, you want to treat that blood pressure and heart rate. And the nice thing is we have one specific specific class of antihypertensive that treats both at the same time, which we're always concerned about. And that ends in your OLOs, and that's your beta blockers. Ends in OLOL, right? Metoprolol, labetalol, right? Atenolol, that's your beta blockers. It does a specific effect of lowering that heart rate and blood pressure. Now, for your thyroid itself, we can give two different types of common medication. There's a lot of medications out there, but we're going to give two types. And that's called your methimazole and your PTU. So try to remember that, more specific for lowering those hormones right there. Now, multiple different ways, and we take it to the least invasive to the most invasive, right? If that doesn't work, where we replace the iodine compounds, we can do radiation therapy to shrink that thyroid, and at the very last, we just remove it completely. So that's your thyroidectomy. Ectomy, that's stemming from the word removal, right? Dissection, removal. Thyroidectomy, we remove that thyroid. But what's the problem when we remove the thyroid? We now go into a state of hypothyroidism. So again, we're going to take a look at the most common symptoms, right? High blood pressure, high pulse, the exophthalmos, right? With women, think of your marathon runners. They run so much, their metabolism is so high, they're missing their periods, right? They're missing their periods. And if you're missing your periods, you're going to have some sort of infertility issues. So those are the things you get to look at. All right. So let's move on from your hyperthyroid, and let's talk about the other end of the spectrum, which is your hypothyroid, right? Which is your hypothyroid, meaning you are lacking in that T3, T4. So let's take a look at that lab value, low T3, T4. Now, because this is low, what's happening in your pituitary in your brain? It's secreting more TSH, but your thyroid isn't producing T3, T4, so it's opposite, right? High amounts of TSH produced to reach your thyroid, but your thyroid is still producing low T3, T4. So the most common type of hypothyroid is going to be called Hashimoto's, right? Another cause of this can be low in iodine, which is not usually a problem in America right now because all our table salts have iodine. So not mostly a common problem, more of a common problem in more third world countries without access to iodine. Right. So, and of course, thyroidectomy, as we talked about in the previous example, where we're lacking that thyroid. So without the thyroid, no thyroid hormones produced. Right. So what are your symptoms here? When we talk about your hyperthyroid, meaning up metabolism, up energy, let's put everything on the low end, right? Let's put everything on the low end. low heart rate, right? Low blood sugar, low GI function. You are not sweaty. You are probably dry, right? You're not hot. You're probably cold, right? You're not. You're gonna be your slurred speech, right? You have no energy. You're tired all the time. That is gonna be your hypothyroid. You are not skinny. You're starting to gain more weight because your metabolism is a lot slower. So when we talk about that, we talk about everything else that goes down with it. If you look at this nice little section on the upper right, right? So there are certain things that can show slowing down. Constipation means everything's slow, right? Your brittle nails, menstrual disorders, meaning you're still not producing. Yes, you're not producing in your menstruations in hyperthyroid, but also in hypothyroid because you don't have the energy, you don't have the metabolism, right? And of course, depression, slow mind, right? Now, what's going to happen in the more extreme forms of this? Hypothyroid, extreme forms of hypothyroidism. And this is going to be called your myxedema coma, right? Your myxedema coma. Now, when we talk about your myxedema coma, think about everything here going into extreme forms. The biggest thing we're going to be concerned about, again, is your ABC, your circulation, right? Heart rate. We talked about a low heart rate. What happens if it slows down completely? Can you live without a heart rate? I don't think so, right? So myxedema coma, one of your life-threatening conditions is the bradycardia. Also, if you slow down everything else, slow breathing, slow metabolism, slow energy, you just lack the energy to breathe, right? Now, these are patients that are probably going to be vented, probably going to need some ventilatory assistance. So what do we do for this? Well, for myxedema coma, we got to treat the complications. But for simple hypothyroidism, we just give levothyroxine. Replace that thyroid hormone. Hormone replacements. Very, very common. This is probably the most common one, is your Synthroid or levothyroxine or Levothyroid. But I've seen more Synthroid most commonly used in your primary care. Now, one thing you have to teach your patients, this is a lifelong medication. They will always be in a state of hypothyroidism. This is a lifelong medication. All right. So a little recap there. We do a little recap. That's the difference. Hyperthyroidism, right? That's going to be high energy, high metabolism, high everything, vital signs high. Main concern is your blood pressure is high, your heart rate's high. And when we reach those severe levels, we can have a thyroid storm, meaning extremely high blood pressure, hypertensive crisis, extremely high heart rate, right? That could be people getting SVTs. And what do we do for it? We just decrease that thyroid with PT or methimazole, beta blockers to decrease that heart rate and blood pressure, and ultimately we might need to take off that thyroid completely. On the opposite end, a hypothyroid, too low of a metabolism, too low energy, too low of these hormones T3, T4. So no energy, vital signs are low, really slow, weight gain, dry skin, and of course, life-threatening condition myxedema coma. And again, what do we do to fix that? For simple hypothyroid, we replace it with the hormones itself. We replace it with Synthroid or levothyroxine, or we support that myxedema coma, ventilate your patient, give some hormone replacements to increase that heart rate, support the patient, right? Support the patient. So that's it for hyperthyroidism. Please join me again for another segment of your endocrine. All right.